Hi everyone. My name is Rachel Blaufarm. I'm going to be doing my capstone presentation for leadership. So I did do a little PowerPoint presentation just to lay out the objectives for each category. And I'm going to talk about what I did and how I met those objectives, but instead of going over each one every time, I just have them listed on a PowerPoint to make things a little bit easier. All right, so starting with advanced practice, those are the objectives for advanced practice. I shadowed Karen Gonzalez, who is a nurse practitioner at Lehigh Valley Health Network. She is a general surgery nurse practitioner, so she sees patients inpatient and outpatient. We started the day by doing rounds in the hospital, which was really cool to see on post-op patients. The one patient we saw had a rectovaginal fistula, which was something that Karen explained to me was really rare. And she got this because of all the scar tissue she had. She had like a total hysterectomy. She had all these like uterine surgeries done because she had ovarian cancer and uterine cancer. So she had a lot of scar tissue. And Karen was explaining to me how fistulas form and things like that. So we followed up with her. We also followed up with a patient who just underwent gastric bypass surgery. And she was also type 2 diabetic. And because of everything going on, her diabetes was absolutely out of control. Her fasting blood sugar was like over 500. And her hemoglobin A1C was around 10. So things were a little out of control. So before they discharged her, they wanted to meet with the endocrinologist. So I got to go with Karen and meet with the endocrinologist and discuss with the patient going over new insulin protocols and new medications and things like that prior to discharge. In the afternoon, we went back to her office and I sat with her while she did some telehealth medicine calls, a lot of pre-ops appointments for colonoscopies. So I did those with her. And then later in the afternoon, her partner Brian, who's also a nurse practitioner, general surgery, he did a G tube removal, which he let me watch, and I kind of got to assist. I got to hold some things, so that was kind of cool. So that's what I did for advanced practice. It was a fantastic experience. I learned a lot about their scope of practice and things like that, especially when it comes to general surgery. So the next thing I did was the nurse supervisor. Once again, these are the objectives for nurse supervisor. Unfortunately, due to recent events, aka COVID-19, I was not able to attend my nurse supervisor shadowing, and which I'm bummed about because I was really looking forward to that. But I was assigned a case study, and the case study discussed a sentinel event that occurred due to a nurse's error in medication administration. And we got to dig into that and kind of figure out what went on with this case study. This nurse, which is something a nurse supervisor would do, the nurse in the case study foregoed all protocols when it came to identifying the patient, when it came to medication administration. She accepted a verbal order that wasn't placed in the computer system, and the physician also prescribed a very strange, unusual dosage of medication, which the nurse did not question, and she did not double check, and there was a wide range of medication dosage that ultimately led to the patient's death. So I think this case study was definitely a great way to meet these objectives, because it is something that the nurse supervisor would do when, unfortunately, something like that does happen and it needs to be broken down and you need to see what went wrong. So that's the nurse supervisor's job. So the next thing I did was the political legislative. Obviously, for that requirement, I went to Harrisburg with our classmates, which is last time we saw each other. And just from going there, unfortunately, obviously, we weren't able to meet with the legislators that we wanted to, but just listening to some people speak about the current issues in nursing, such as nurse practitioners being unable to practice independently. And I definitely think it stressed the importance of how important it is that healthcare is involved in politics, as we're seeing today, unfortunately. But with people leading us like Dr. Fauci and Dr. Levine, it's super important that healthcare is involved in politics, and it starts with nurses. Learned about a lot of current nursing issues, such as mandated staffing and things like that. So I think just going there and seeing everything, I think it kind of stunk that we weren't able to meet with the legislators, but I get it because we were on the midst of a public health crisis. So it was an interesting time to go. So for my community requirement, this was my favorite one. So I did 2 hours doing Meals on Wheels with these two wonderful volunteers. They've been doing it for over 15 years. They've been doing it twice a week. They're really actively involved. They not only financially donate, but they donate a lot of their time to delivering these meals. And over the last 15 years, they've like grown such a relationship with these people. They deliver to the same people twice a week, and they know them, and they know their dogs, and they know their kids, and it was really cool to partake in. The one thing that I did learn is the one client that we delivered to, when she answered the door, she was like super, super disheveled and like really tearful. And the volunteer was like, "Oh, what's wrong?" And she was like, "Nothing," and slammed the door. But it was like very obvious that something, whether she wasn't feeling well mentally or physically, like it was very obvious that she was not doing well. And I didn't realize that Meals on Wheels actually has a protocol that if they kind of have like a gut feeling that something isn't right, they have a list of their emergency contacts. Sorry. So the volunteer actually ended up contacting her emergency contact and was able to advocate that something was wrong. So I think that was really cool. Another thing that he told me was the one client we went to see was a quadriplegic who he's been delivering to for 15 years and actually never met him. And we were instructed to go into their apartment and deliver this meal, which we did. And the apartment was just something like right out of the show Hoarders. Like it was really sad, and it was just not a healthy environment for someone to be living in. And this volunteer informed me that they've actually contacted social services and things like that to try to help him. But unfortunately, he declined any assistance or anything like that. But I think just learning that Meals on Wheels, the volunteers play such a key role in the community and advocating for clients and just another form of a welfare check on those that need it. I also went to the Lehigh County Prison, and that was cool. We followed around nurses doing their med passes. They do them in the morning and in the afternoon. I learned that they actually crush all of their medications, psych meds, pain meds, anything. Even if it says do not crush, they crush them. So I learned that. And I also observed a dentist removed a wisdom tooth with just local anesthetic. So that was something. And yeah, and it was just crazy to learn what the nurses do there. They do the med passes morning and evening. They have triage. There's a nurse practitioner there that sees the patients, and it was just like really cool. Really cool. The next thing I did was service leadership. I started off the semester doing a few hours at Daybreak, which is a drop-in shelter that provides 3 hot meals a day to those that are homeless, suffering from mental illness, drug or alcohol addiction, or HIV and AIDS. It was actually originally started by Lehigh Valley Church because the Allentown business owners were not pleased that the homeless community was hanging outside their businesses during hours of operation. So they all came together and opened this shelter as somewhere for them to go during those hours. When I was there, we helped serve breakfast and lunch, as well as socialize with a lot of the clients and learned a lot of their history. And yeah, So that was cool. And then for the rest of my service leadership hours, unfortunately, I was unable to fulfill them at daybreak. I did make some masks. I donated them to a classmate's office, and I actually learned how to make masks using my old, very expensive, unnecessarily expensive LuLaRoe leggings. So that was cool. I made some of those and gave them to my family. And yeah, that's how I met those objectives. For continuing ed, since the continuing education day was canceled at DeSales, I did 2 online seminars. One was regarding COVID-19. The other one was discussing prescribing opioid medications and the epidemic that goes along with opioid addiction. So from these seminars at that time, I learned current research of COVID-19, but things have changed since then. And I also learned how they monitor prescribing of opioid medications and things to look out for, and patient care regarding patients on taking daily opioid medications. For interprofessional, I went to Country Meadows Retirement Community. Every day they have like a huge meeting with the director of nursing, the head of the nursing staff, floor nursing, respiratory therapists, occupational therapists, anyone that is there that is a part of patient care. They do a big meeting every day just so everyone gets on the same page. They go through pretty much all of their clients of who they're responsible for, and everyone just kind of does like a really big like report. So I got to observe that, and that was pretty cool. For patient logistics, this experience was actually a lot cooler than I thought it was going to be. Going to the patient logistics department, when you work in the hospital, you don't really realize how much goes into it. So for patient logistics, I got to get some insight on exactly how important it is to have this department. They do everything from admissions to transfers, and you would never think how much work goes into figuring out where to put a patient. You would think, oh, we're just going to put them in this room. But there's so much that goes into it, and I'm really glad I went to it because it was, you would never think that there was that much work that goes into it. They took me through the birth to death process, from when a new patient is born to when a patient dies, what happens on their end of things. So it was really interesting to see how necessary it really is. For peer leadership, I went to Holy Family Manor with Professor Geller with the 309 students. This was their first clinical day outside of lab day, so I was just there acting as a mentor. I talked to them through their therapeutic communication lab, and then we went back to HPB to go over range of motion and therapeutic communication, and I helped them with their care maps and gave them some tips for video recordings, and that's what I did. For independent, I worked with other students and Professor Fruchtel to run the Skills USA competition. It's an international competition for high school students that attend vocational technical schools, and they compete for a chance at scholarships and other opportunities. So this day, my role was a judge, and I graded students on their skills and taking vitals, and some of the requirements were about their therapeutic communication with the patient and how accurate their vital signs were. So I got to use one of the simulation dummies to do that. So that is the end of my slideshow. I'm happy that I got to go through some of the things that I did. I'm glad I did the bulk of my hours in the beginning because I got some like really cool experiences. And yeah, that's it. Thank you.